Thank you very much for the introduction and also for the invitation and also for the possibility to be here because I'm extremely happy to share the CPT's views and also my, maybe if you allow me, my personal views about the situation of LGBTIQ+, especially TG people in some prisons. My presentation goes to two directions. In the first part of my presentation, I would like to introduce you into the working methodology of the Committee for Prevention Torture of the Council of Europe, how we are doing our monitoring activities. And then I would like to raise some issues from our 33rd General Annual Report, which was very recently published in 2023. And the major topic of this annual report are the issue of TG people in prison settings. So, the Committee for the Prevention of Torture is a Council of Europe body, and it is very important, unlimited access to several places of detention, all the places in which people are deprived of the liberty, and also to all persons who are deprived of their liberty, and the delegations which are sent to the places of detention, they are entitled to look into every kind of documentation related to the people kept there. This is very important because in some member states of the Council of Europe, there are no NGOs which are entitled to enter places of detention in an effective way. Not even the NPMs in some countries are effective. NPMs are the national prevention mechanism under the OPCAT. And in some countries, we heard that unfortunately these bodies are not effective. We organize two types, mainly two types of visits. One type, or the first type, are the so-called periodic visits. In an average sense, I can say that in every 4 years, every member state of the Council of Europe, 26 states of the Council of Europe, receives CPT periodic visits. Police stations, prisons, psychiatric establishments, social care homes, and also immigration detention places are going to be visited by our delegation. The delegation members are chosen by the committee from committee members. And there are also some experts joining the delegation, and this forms a delegation which visits the places. And we can have some private interviews. This is a group interview. Sorry. As you can see here in the picture, a person standing in the middle. His name is Hugh Chetwynd. He's the head of the secretariat right now of the CPT. He is having a group interview at a place of detention in a country. It opens up the possibility to have a direct conversation in a confidential manner to each and every detainee at the place. As you can see here, he is approached by several detainees. I suppose that this place is a immigration detention center in a country, I cannot remember which one. And each and every prisoner can raise an issue. And after this, maybe the interviewer decides to have a confidential interview, a completely confidential private interview with the person concerned. And of course, in a group session of interview, you cannot raise some extremely delicate issues. For instance, your LGBTIQ plus identity. Therefore, there is another quite effective type of interviewing in which we can visit people in the cells. As you can see here, Mr. Petr Hnatic, he is also a member of the Secretariat, doing a private interview in a cell with a person deprived of his or her liberty. It is very important because this is not research, this is not based on questionnaires. Our methodology is mainly semi-structured interview-based. So we have a lot of questions, almost standardized questions, and if we find something quite problematic, we can follow up the case, and we can interview also other people deprived of the liberty, other prisoners, to have a double check. And we use also triangulation. It means that if we have something, if we have more allegations about ill treatment, we can go to see the documentation of the case as well, and we can check also the medical files of the person. For instance, if a TG person in a prison says that he or she hadn't access to proper medical care, and we have another interviewee who says the same, we go also to talk to the medical doctor, and we search for evidence whether the person was there on the medical check or not. And if we find that this was the reality, not only an allegation happened, that they only said that they did not have any kind of access to the proper medical care, then we can raise this issue during our final talks with the director of the prison or any other establishment where people are kept. So this is, I think, very, very important, that our information, which are described in our report, are based on the reality. And we criticizing also ourselves during the visit, because we double check everything, and if we hear a very severe allegation of ill treatment or any kind of allegation, we try to go after the case. Yes. And as I have mentioned, after these visits and interviews with staff members and detainees on the spot, we collecting our information and we prepare a final feedback to the managers, to the directors of the establishment. And of course, they can react. And at these talks, or during the introductory talks to those people who are the managers and directors, sometimes we experience something very interesting related to LGBTIQ plus people. For instance, I'm a person who raises this issue as we entering the prison. And I ask, do you know how many transgender people do you have here? Do you know how many LGBTIQ plus people do you have here in your facility? And sometimes they are extremely surprised. And they say, we don't have anybody. I never heard about that. You know, in the second decade of the 21st century, this is extremely interesting how people are not aware about this issue. And as it is written here on the slide, at the very end of our visit, we have visited a lot of places of detention, prisons, police, psychiatric establishments, and everything. We have a final talk with the government officials, and we summarize our finding, and we give a high-level feedback to the ministries responsible for those places. And after arriving home, each and every delegation member try to find a note or a draft notes, and we send our notes to a secretariat member, and the secretariat member tries to draft a report. And in the draft report, we mention only those issues in which we are agreeing that this was the reality. And then the draft report goes to the plenary meetings, and the plenary, the CPT committee, adopts the report, and it will be sent to the government, and the government decides whether it publishes the report or not. In some countries, there is an automatic publication procedure, which means that if they receive the report and if they write a reply on that, everything, the reply and the report will be published automatically. Why I'm saying this? This is very important because I'm going to tell you some details later on about this issue. Right now, our newest annual report is the 33rd, but we have mentioned the issue of LGBT people in prisons more than 15 years ago for the first time. Do you understand this? So, some well-respected international experts went to some Council of Europe member states prisons, police stations, 15 years ago as well, and they had this experience. And they agreed that these are not only allegations, these are discrimination, these are ill treatment, and they raised it for the plenary, for the whole committee, and the committee adopted this. So there are 46 people who agreed upon that, and in a very, very international setting. And if this finding is in the report, it means that we should take into account. We should deal this issue very severely. Yes, and in case in which we find an extremely severe case which needs immediate intervention, then we can use the tool, the Article 8.5 procedure of the Convention of the CPT, that we can, on the spot, ask the authorities to stop this procedure, what they are doing. And if they lack the cooperation, then we can raise Article 10.2, which is the public announcement, in which we describe the situation in very short, maximum 1 page, and we publish it without the consent of the state respected, what is going on in the country. And of course, we are in strict, in very, very tight cooperation with the national prevention mechanism. And right now, I would like to raise some issues related to our topic, the placement and treatment of transgender and other LGBTIQ plus people in prisons. But of course, before doing that, I know that not only in prisons is the case that these procedures are quite problematic. For instance, if I go to visit a police station, I always ask, what happens if a transgender woman enters this police station and there are all the detention cells at your police station are occupied by men? What are you doing? And in this case, in some countries, the head of police stations are very attentive and they say what they do. For instance, they transfer the person to another police station, or they transfer the men to other police stations. But in the vast majority of the countries which I have visited, they don't know any reply on this, regarding this problem, what to do with a transgender person in a police station. But what we have seen in prisons, and it was already mentioned for different times, for many times, also here during this conference, that there are different policies and practices and debates about the placement of the TG people across Europe in prisons. At some places, these people are placed into prison cells based on their identity cards. And at other places, it was also mentioned, they are placed at the prison sections corresponding to the gender with which they identify. And we also concluded in our general reports that gender-affirming surgery is not a precondition for doing that, and also not the hormonal therapy. So people who have this declaration of their identity, they don't need to be undergone hormonal therapy or affirmation surgery. And these people are extremely vulnerable, as it was already mentioned during this event, and therefore all prison staff members who are part of the admission procedure to the prison should be very aware of the pre-prison experiences of the people who are transgender. Because, for instance, the Bangkok rule says that all the women should be interviewed during the admission procedure related to their gender-related violence experience. Transgender women are also women. So some prison authorities are not aware on that. And of course, they are doing some interviews, but sometimes they are neglecting the very fact that the people are transgender people, and they suffered also some gender-based violence also in their childhood, under 18. And therefore, the prison admission procedure is extremely crucial. And also the risk assessment, which was mentioned also during this event, the risk assessment and the ongoing risk and need assessment is also very important. So the risk assessment is not a tool at the admission. It's a very important part of the admission procedure in a prison, but also ongoing the sentence. If the person is placed from a place to another place in the prison, there should be an individual risk assessment done as well. And yes, and in some cases we saw, and this is what we recommend, that people with transgender identity should be placed in a group setting, should be allocated in a group setting, and not in a disciplinary section, which we also witnessed. For instance, the CPT went to prison in a Western European country, and the experience was that transgender women were segregated in a male prison into the disciplinary unit of the prison, which is not so professional. And what we have seen also quite frequently, that these people, because of their vulnerability, authorities think, should be placed together with sexual offenders, which is also a mistake. But unfortunately, there is overlap between sexual offenders and transgender people. unfortunately, what happened in Scotland, in the tabloid, you can read some reports about that, what happened, but this is extremely exceptional. So what is written in the newspaper, maybe it is the truth, but it is exceptional. Not all, of course, not all transgender people in prisons are sexual offenders, and they don't pretend that they are transgender. So this is a prejudice which authorities have to combat. And another important issue are the body searches. At at many occasions, body searches can occur in a prison setting. For instance, also on a daily basis. We have visited the country in Council of Europe in which after prisoners finished their daily work, each and every prisoner had to undergo to a full body strip search, which is an extremely invasive intervention and extremely humiliating for the transgender people, especially if they have to do this in the front of other prisoners and in the front of prison guards who are not the same gender. And full body strip searches are completely abandoned by the CPT. We don't recommend to do that. We always say that strip searches should be done in a two-phase procedure. It means first the upper body and then the lower body should be inspected in a private setting, not in the front of other prisoners. Transgender people in this case are quite tricky people, so to say, because they have different upper and lower body parts than the non-transgender, the cisgender people. Therefore, they can choose what gendered staff members should do the body search for them. And if it is problematic, it is written also in our annual report, that if it is problematic, then the person makes a declaration what kind of gender she or he identifies with. And in this case, the same gender person will do the strip search. Yes. Okay, thank you. Thank you. And something also very problematic, I would like to raise your attention related to this, is the transport of prisoners. Because if you can create a safe setting for the prisoners in the prison, you can create a group accommodation, a group allocation for them. But if you transfer them, unfortunately, in the transport car and in the transport cell, these people can meet other toxic masculine prisoners who are the perpetrators of interprisoner violence related to transgender people. And I think this is going to be my last point here, what I have written in red. The role of prison psychologists in this sense is also very important, because there are also some people under 18, the children, who face the same problem. So they are also transgender, and they have this gender incongruence, which is defined by the ICD-11. It was removed from the psychiatric part of the ICD and put to a completely different part of the ICD. And a prison psychologist should differentiate between gender incongruence, which was the former gender dysphoria, also nowadays written in the DSM-5, which is quite interesting. So gender incongruence in the ICD-11, they should differentiate this with the borderline personality characteristics, because some adolescents have the so-called normative identity crisis. And in this case, they should somehow differentiate between the two groups. And this was my last point. And maybe the last bullet here on this slide, the trauma-informed treatment or care is also very important. So these people are extremely sensitive, and all staff members, not only the medical doctors, psychologists, social workers, but also on the lowest level, guards should know what happened to those people in the past, and they should approach those people bearing in mind that they are traumatized. And almost all of this, what I have mentioned during this short introductory, is written on the CPT's webpage. You can see it on the slide. And I copied also the direct access to our annual reports on the left, on the right side of my slide. And please visit the CPT's webpage because it is very, very interesting for everybody to read. Thank you very much for your attention.